Hello, my name is Caitlin Ledger, and I am doing my informative speech on the effects of teen pregnancy. In my audience, I have my neighbor Denise, my mom Linda, and my grandma Sally. In today's society, there are many influences that encourage teen pregnancy. If you were to turn on the television, you would see shows such as Teen Mom and 16 and Pregnant, as well as drama series like One Tree Hill, Gilmore Girls, and The Secret Life of American Teenager. By glamorizing sex, many teens become desensitized to the effects of an unplanned pregnancy. By looking at the importance of education, the physical and psychological effects of a teen pregnancy, and how by proper planning can create a successful future, we can decrease the number of teen pregnancies. While many students are looking at colleges they plan to attend, some teen girls are looking at this. A positive pregnancy test in an uncertain future. By the age of 20, 3 out of 10 girls will already have their first child. That's 750,000 births per year. According to Olivia Marshall, author of The Dropout Crisis in Teen Pregnancy, says that 30% of teen girls cite that the reason why they left high school was due to their pregnancy. According to the teen pregnancy statistics, they say by the age of 30, 1.5% of teen moms will have their college education. At the second picture, these statistics say 33% of teen moms complete high school, 1.5% of teen moms have a college degree by the age of 30, 22% of daughters of teen moms become moms themselves, and 13% of sons born to teen moms become imprisoned. When making the transition from middle school to high school, many teens fall vulnerable to the effects of peer pressure. Some kids get involved in sex, drugs, and alcohol. When a mother is pregnant, anything that she puts into her system goes to the placenta and is fed to the baby. According to Teen Pregnancy, Medical Risk and Realities, if you have a teen girl who is under the effects of drugs right now or alcohol, or during her pregnancy, when she has the baby, it can go through withdrawal symptoms, as well as having seizures, strokes, and could possibly have mental retardation. Other health issues consist of low birth weights, long-term illnesses, and learning disorders. According to Bahandra Kamalasanan, author of 4 Traumatic Emotional Effects of Teen Pregnancy, talks about the physical, mental, emotional, and financial problems that these young girls face. And the physical part of this, many of these girls will see their bodies start to change. They may have a larger stomach due to the fact that they are now carrying a baby. They may see their appetite increase more now that they are not just feeding themselves, but feeding another human. They may start retaining water, so their ankles can swell or their legs can swell. And they can find themselves being a little bit moody, as well as having stretch marks on their stomach that were never there before. For the mental aspect of this, as a teen girl already, our hormones are already raging through our body. When you add a pregnancy into the situation, your hormones can increase. Sometimes it can cause an imbalance in your brain. Some of these girls, after they have their child, if they don't have that bond with their daughter or son within the first 6 months, they can develop something called postpartum depression. For the emotional side of this, many of these girls may feel like they're alone and have no one to talk to or to lean on, especially if at home the mom and dad or anyone who is there does not support their choice in this. They could also feel isolated from their friends, and at that point, if you have a friend or friends who leave you at this situation, sometimes it's hard because that's when you need them the most. Some of these girls could also feel judged by their peers or their teachers, and they can also feel tormented due to their sexual behaviors. Last but not least, financing is a very hard thing in today's society. It's hard enough to find a job that can support just one person, let alone to have to support yourself along with a baby. Babies cost thousands of dollars each year due to medical bills, toys, daycare, and food, and other things like clothing. We need to teach these kids to step up to the plate and not go down this path if they don't need to. Ruth Solinas, author of What Can We Do to Prevent Teen Pregnancy, talks about these 4 key points that can change these teens' mind. First, she talks about the information on STIs, which stands for sexually transmitted infections. Next, she talks about making parents more open and willing to talk to their kids and even other friends about sex and being more willing to communicate and to teach them the proper ways of it. Next, they talk about having school programs to up the sex education and maybe increase different things so that the kids do get a proper background in this. And last, we talk about the contraceptive availability. I believe that many teens would have less pregnancies if they understood where they could get a condom or birth control, when it's available, and the percentage of if you use it compared to if you don't, and how it can stop a pregnancy and even diseases. When I was in high school, I was the president of a STARS program at my school, which stands for Students Taking a Responsible Stand. We would go over to the middle school, and I would teach 6th, 7th, and 8th graders about how to say no to sex, drugs, and alcohol, if they or their friends were in an emotional or sexual relationship, if they were being abused, and how to go and tell someone about this so they can get to a safer spot. It would break my heart to see some of these girls at that young of an age coming up to me and telling me that they were already in a sexual relationship, and some at the age of 14 were already going into high school pregnant. At that age, they should not be worrying about their pregnancy and having that burden on their shoulders. Instead, they need to be focusing on their future and where their education is going to take them and if they're going to college, not how are they going to support this child, especially if they're on their own. In this last picture, I am going to show you, it says, "I never thought I'd be a statistic. More than 750,000 teenage girls will become pregnant this year." By looking at the importance of the education, the physical and psychological effects of an unplanned pregnancy, and how by proper planning can create a successful future, I hope that we can stand up together and teach these kids the proper background that they need to not go down this path in life. I hope on one level or another I was able to reach you guys, and as a society we can teach these kids not to become another statistic. Thank you.